Hello, my name's Lori Lamonto. I'm a licensed professional counselor. I'm also a licensed clinical drug and alcohol counselor. Most of my topics for this channel, it's on the courage to change. How does someone make the shift and a change when they have had possibly trauma? It comes from the God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So there's going to be lots of topics that come up related to trauma, related to recovery, related to different diagnoses as well. So today's topic, though, is, how both ADHD and PTSD overlap. And sometimes that's, something that can only really be assessed, we'll say, by a psychiatrist or someone who does assessments to see, are you ADHD? Are you PTSD? Are you both? Okay, I have a form to show, and I'll put it in the link. I'm going to try to see if I can get it up on the screen clearly. It's just a printout, but it shows, if you can see it, that the trauma's on the one side, the ADHD is on the other side, and then everything in the middle overlaps. Not sure if you could read it right, not sure how that looks. I'm going to try to put a link down in the profile so that you can maybe see exactly what I'm talking about and why you would need a professional to determine this. Okay. The thing that I think is most, prominent right now is not to feel stigma or not to have some kind of stereotype or some kind of, perspective or bias or prejudice against whether you have PTSD or whether you're ADHD or another diagnosis. It seems to be really hard for people to come to accept certain diagnosis, and then other people are relieved. They're relieved to know, wow, thank God, there's finally something that can explain why my brain works this way, why my body works this way, what's exactly happening. So I did a short clip on trauma and how trauma can be with childhood and how post-trauma is after the event, and how, coming up in the future, we'll do some steps of how to make that be a little less present and how it can be further in your memory. So it's not so current and you can move forward from that and recover from that. Today's topic is going to be more about the ADHD, a little bit more about how the executive functioning works. What happens, why sometimes the reactions and the way you might behave get looked at by other people with a crooked eye or a correction or some kind of, shaming or making you feel guilty. So basically what's going on in the executive functioning, that's where you make decisions, okay? It doesn't move as fast as the rest of the body, okay? So the rest of your body is functioning just like your heartbeat. Things are happening automatically. The brain is functioning, the neurons, the synapses, the parasympathetic, the sympathetic nervous system, everything's just going. You don't even realize it. It's just pumping and it's pumping and it's pumping and it's going. However, when it comes to ADHD, you have the part of your brain in the executive functioning that is going like this. So a lot of times what people do to bring up this, to go like this, there's lots of ways that people come up with, because typically when people know that they have ADHD, they can recognize something is racing, something's off. So some, sadly enough, turn to drugs. They'll say, let me go get a stimulant, let me go get some kind of alcohol, let me go get some kind of cocaine or something to stimulate, to make that faster. So you wouldn't think when you're hyperactive that you're going to need a stimulant, but you do need a stimulant, a dopamine. You need something to make this go, to fasten, make it fast, okay? So these neurons and synapses want to connect. So sometimes people will turn to drugs. Other times people will go to a professional and get stimulants. And they can get addicted to those stimulants, and they can, abuse those stimulants. This here is not about abusing it. This is about explaining why you even got it. So the Adderall, the Ritalin, the Concerta, the Vyvanse, and more Okay, why you're getting a stimulant when you're hyperactive. Why you're getting a stimulant if you're in trouble a lot and you can't contain yourself. You feel like you're on a sugar high all the time. So you're getting a stimulant though for that specific part of your brain to go. So typically the medicine is going to give you this place of like, wow, I feel more stable. I can organize my thoughts at school. I can organize my thoughts when I clean my room. I'm not as distracted. I can make executive correct decisions because it's now flowing. Sometimes people need it once a day, sometimes people need it twice a day. Sometimes you can take off from it and decide to just be a little bit more rambunctious on a weekend, okay? However, if you don't use sometimes the pharmaceutical meds and you turn to substance use, that's one way. But other times people can turn to other dopamine hits, whether it be a porn, whether it be overspending, whether it be sex, something that stimulates to bring you down to this neutral place. So I'm trying to explain it to you first so that you don't feel so separated and that it's explained. This is what's going on in my brain. Now I know why I do some of the risky behaviors. Now I know why I haven't been able to make better decisions. I'm encouraging, if you feel like you have ADHD, possibly with trauma, possibly without, maybe just ADHD, maybe just ADD, attention deficit, and you're not as hyper, don't be so against the medication. Be open to it because it will. All of a sudden you'll recognize, wow, this is the way most in society can function if they don't have ADHD or ADD. A lot of times kids, young adults, my generation, because I'm older, we didn't even recognize ADHD until years ago. So some adults now are finally getting a title or a label or a diagnosis and the proper medication. Now they realize why they got in so much trouble and they were considered these troublemakers. Okay, please don't hesitate. Don't take it as a stigma. You're only going to cause yourself some harm. You know, maybe your parents might feel a little afraid to let you try them. It's just better off than going to street drugs, and it's better off than getting into a lot of trouble to shoot dopamine. Some are, non-stimulant ADHD medicines, and maybe that's a choice that you or your family or you as an adult would decide. But this is about trying to explain where and how the brain works, so then you can start to understand, I don't have to be in trouble all the time. I don't have to be risky all the time. I don't have to cause drama or, react a certain way all the time just because my executive functioning is not flowing. It needs a stimulant, whether it's dopamine created, whether it's drugs from the streets, or whether it's pharmaceutical. It needs it. Don't be against yourself. Don't judge yourself. Don't shame yourself. Just know I need this or I'm going to end up being in more risky behavior. So I'm going to put this paper in the link, hopefully if I can figure out how to do that. And then you'll be able to see and maybe get a proper assessment from a specialist. But again, this is about change, courage to change. How do you make that change? How do you pull that trigger to say, I'm going to try a medicine, or I'm going to even attempt to see a psychiatrist to see if I have this diagnosis and not feel shame about it? I'm encouraging you, okay, because we want to get less traumatic. We want to get less dramatic, and we want to be able to have you be more peaceful. I hope you press the like button and the subscribe button and continue to change your life for the better. Thank you.